Why don't we get started? So, welcome everybody. I know people will continue to trickle in either in person or online, but this is Tavio Akimescu. Welcome to our Implementation Science for Innovation and Discovery series. Today we have a research presentation. I made this point in the past that sometimes we have foundational kind of more course type of presentations about different building blocks of implementation science or related disciplines. But we're trying to intersperse them with some more practical and research progress or projects results by our stakeholders internally and externally. Today we have Dr. Marion Schmidt presenting. She will be talking to us about how you link context, determinants, and outcomes in implementation science. Dr. Marion Schmidt is currently a postdoctoral researcher at Medical College of Wisconsin and the Department of Psychiatry and Behavioral Medicine in the Center for AIDS Intervention Research. She has a PhD in public health with a concentration in community and behavioral health promotion from University of Wisconsin in Milwaukee, and a Master's of Science in Psychology from Arizona State University. Her research interests are centered on improving access, utilization, and outcomes surrounding mental health by, of course, using implementation science methods and tools. She's interested in topics surrounding youth mental health, suicide, substance abuse and use, trauma, pain management, and social support. So without further ado, thank you very much for being willing to deliver today's presentation, Dr. Schmidt.
Yeah, thank you for having me. Let me share my screen quick and then we can get started.
Perfect.
Right, well, thank you all for having me. Again, my name is Marion Schmidt. I am a postdoc here at MCW. I've only been here since March, so I haven't, the work that I'm going to be talking about today wasn't anything that I've done here. It was actually part of my dissertation work. But I wanted to share this work with you all today and then kind of connect it to some recent discussions in the field about how to advance the field and also it's kind of MCW's potential position in doing so from my perspective and just my short time in being here. So I'm sure we're all very well aware, dissemination of evidence-based practices from research to real-world settings is quite difficult. The, practice has to be appropriate for intended audiences, adapted to local needs and contexts, financially sustained. And then there's what is known as that research to practice gap, where it's been estimated that it takes an average of 17 years to incorporate evidence-based practices into routine use. So as you can imagine, many never reach widespread use or are irrelevant by the time they do. So that's just so much, knowledge, time, resources that's not making its intended impact. And then implementation science is a field aims to address this gap. So, it examines or tests methods to successfully integrate and sustain evidence-based practices into routine care. So, what works when and for whom. And I do want to recognize it's not always an evidence-based practice, but I use that just kind of for continuity as that's what is commonly looked at. Two very common areas of research and implementation science relate to determinants and outcomes, which is what the research I'll be focusing on today is about. So, determinants are often known as those barriers and facilitators. They're contextual factors that impact the implementation process. These are very vast and include things inside the organization, like its culture, things outside the organization, like local or federal mandates, as well as people involved. So both those implementing the program and those receiving the program. And then these in turn impact outcomes, which are the measures of success or failure of the implementation efforts. And these outcomes are really important to examine because they're precursors to effectiveness and participant outcomes. And it helps us understand, if expected outcomes are not seen, is it because that program was ineffective for that setting or population, or was it just implemented incorrectly? So currently there's a lot of research that looks at determinants and outcomes separately, and the research examining the relationship is small in comparison, but it is growing quite a bit. However, often these studies are just descriptive and will look at one or two outcomes at a time. Often as well, approaches have been very diverse. And so it's difficult to kind of examine at a systematic or high level to kind of find commonality and to, help identify what really is impacting the implementation process and how to improve that. As you know, implementation changes so rapidly and resources are often so tight, better understanding of this relationship between determinants and outcomes is really important. In addition, systematic assessments typically are organized by field or setting. So this is the case for both determinants and outcomes. So, often reviews will look at mental health programs or cancer programs or just programs in clinical or educational settings. And while this level of specificity is certainly relevant and important, across field or cross setting assessments are needed as well, because while there's always going to be unique settings or unique, factors that affect a certain setting or field or intervention, it's also likely that there are persistent factors that are relevant regardless of what you're implementing or where. There have been a handful of reviews that I found that have done kind of like reviews of reviews across field and settings and have found similarities, but there hasn't been a whole lot that I've seen done with that so far. And then finally, there's just so many determinants that we are aware of, but there's not any kind of way to organize them into key determinants or, what are found to play the biggest role in the implementation process most frequently. So, a very commonly used framework, CFR, I'm sure many of you are aware of, the Consolidated Framework for Implementation Research. It currently has 48 constructs and 19 subconstructs. So that can be really hard for people to, decide what to focus on in the further project, or people disagree, and it, often changes, sometimes naturally, or sometimes because of different strategies that are employed. But so while we don't want to downplay the potential all of these determinants play, being able to identify which, consistently play a bigger role in the implementation process could really help guide future efforts. So to aid in this understanding, Darmstadt and Lowry in 2013 developed this rating system to identify which constructs from the CFR framework have the strongest impact on implementation. So this criteria is used to rate qualitative data and examines both variance, so positive and negative effect, as well as magnitudes or strength of the effect. So, -2 is a major barrier, -1 barrier, and then neutral, 1 facilitator, major facilitator. And while this rating system's been used by researchers for over a decade now since it's been published, I hadn't found a systematic review looking at this kind of more holistically. So that brings me to my research. So I had 2 aims I'm going to be discussing today. The first was to identify which determinants play a key role in the implementation process. So of course I'll go into more detail, but I did this by conducting a systematic review of those articles using the rating system I just discussed. And then second, I aim to assess the association between specific key determinants and implementation outcomes across numerous health interventions by first developing a questionnaire and then administering it to implementation researchers. Then I had 2 research questions, which were really more kind of exploratory, but they were in regards to similarities and differences across field and setting. So comparing mental health and non-mental health programs, as well as clinical and non-clinical settings. And then before I proceed, I will just want to make a comment about implementation strategies in case anybody is that's a question in the back of your mind as I go on talking about this. Strategies are very important as they guide, enhance the implementation of a program, and they really mediate this relationship between determinants and outcomes. So to get a full picture, you have to consider the strategies, but in this project, it was just a very macro, high level of this direct relationship. And just jumping ahead, I do capture a little bit of information about strategies used, but it's not used to kind of make any sort of statements about their impact or anything at this point. So I used 2 very commonly used frameworks for this project. One, the CFR, as I already mentioned, the most commonly used framework looking at determinants, first developed in 2009, was just updated in 2022. For this project, I do use the 2009 framework. I have the 5 domains and just a couple of the different constructs and subconstructs here. I used the 2009 instead of the 2022 for a couple of reasons. First, I did the systematic review just a few months after the updated version was published, so there's no studies that have been published utilizing the updated framework yet. And then second, for the questionnaire, again, jumping ahead a little bit, I provide a couple of different of these CFR constructs, and I provide the definitions. And well, some of these constructs don't change at all or just a little bit in the updated framework. We just wanted to to streamline things, make it consistent, and make sure we're talking about things that people were very aware of, much more likely to be aware of. We just kept it remain with the 2009 framework for the questionnaire as well. And then I also use the implementation outcomes framework, or IOF. It is also one of the most commonly used frameworks used to examine outcomes. It's first developed by Proctor et al. In 2011, has 8 different outcomes all listed here. And, both of these frameworks are kind of more of like taxonomies of like pertinent determinants and outcomes, but are used just to, stay in line with the other research. So now I'll go on to my first aim. So I conducted, as I said, a systematic review of articles that utilized the Darmstadt-Lowry article using the rating criteria that I discussed. Inclusion exclusion criteria were very broad. Basically, if they used that rating system or rating scale to look at both the magnitude and variance, provided that data, and it was written in English, the article was included. It didn't matter design, type, or setting, community of focus, or anything like that. In total, 48 articles were included. It covered diverse programs. About half took place in the US, about half were outside of the US. In the corner here, I put a very simple example of what the data table looked like. So in the columns were all the constructs, articles were in rows, and I just simply pulled the rating scores that they provided. They all had aggregate scores, most frequently by site. So there was multiple lines of data collected from most of the articles. In total, it was 301 lines of data from the 48 articles. Also in addition to the framework or the constructs from the 2009 framework, I added 2 new ones that were consistently used in studies. They're both a part of the process domain sub-constructs of engaging. So this first one, engaging participants, was used to capture engagement, of those receiving the program. So often patients in a clinical setting or students in an educational setting. And then engaging key stakeholders was also commonly used by different articles. A few didn't really clearly define what they meant by key stakeholders, but most considered them individuals directly impacted by the innovation, like staff or leaders. So this construct, was added to capture that aspect as well. And then I looked at the data in a number of different ways to get a very comprehensive understanding of it. So looked at those most frequently rated or cited overall, most frequently rated as a major barrier, -2, major facilitator, +2, either a major barrier facilitator, and then compared and all those views and tried to come up with 5 to 10 determinants, partially just to keep it manageable, but also I notice often they're not all the time, but often there would be kind of like a cutoff or drop off around the 5 to 10 mark. So once I looked at all those, I came up with 8 key determinants. And so here they are, and I'm just going to very briefly define each of them. We'll talk about them a little bit more as I'm going on with the questionnaire as well. Leadership engagement refers to the commitment of leaders and managers with the implementation effort. Formally appointed internal leaders are those appointed inside the organization that lead the implementation effort. Compatibility is that tangible fit between the intervention and the organization, or how it fits with current workflows, things like that. Available resources includes things like funding, space, staffing, training. External change agents are those outside the organization that guide or influence implementation. Champions are those inside who are dedicated to supporting the implementation, improving buy-in. Relative advantage is the perception that the intervention has an advantage over a different or an alternative solution. And then in key stakeholders, as I mentioned again, are those kind of key staff and leaders. So of these key determinants, 5 of the 8 were kind of individual or people-focused determinants. I thought that this aligned with the updated CFR framework because it significantly updated the characteristics of individuals domain. They renamed it individuals, and this expand and clarify about the impact that individuals have through additional subdomains. And this update in the new CFR framework was meant to reflect the important role that individuals play, specifically like the unique characteristics they have and how like individual behavior might shape implementation. Then this also aligns with, Rogers' diffusion of innovations, which orients diffusion as a very social process and looks at, networks and communication and different types of adopters. Uh, so I think this finding just kind of suggests really the importance of people in the implementation process and how, an organization may have all the funding and resources necessary, but if the right people aren't engaged in facilitating the program, it could still really struggle. And then just kind of,
Can I ask you a question?
oh yeah, go ahead.
Can I the way you came up with these key 8 determinants, was it based on prevalence or frequency of appearance in different articles, or based on your scoring coming with the most negative or the most positive scores?
It was from like those that would have most frequently would have like the -2 or +2, pretty much. I did look at
I see.
just how often they were cited overall, but I was trying to use to say, there were some that were very common, just like a facilitator, but which ones were often like a major facilitator to show that they're like making the biggest impact. So I looked at it in a number of different ways, but the main kind of weight was which ones are showing up as the major barrier or the major facilitator projects.
Do you think that could be a function of how significant was the change of the change management involved in the specific articles? So if they were planning to do a major significant change for the organization, and they found that leadership was not aligned, as they may not be with major changes, do you think that will skew the results towards contribution from one determinant versus another?
A little bit. I do, I do talk about this in my limitations is that, when you are looking at the rating, you're losing that nuance, that detail. But, all the different projects have, most of them were organized and like looked at the data in a very similar way, but they all have a little bit of, nuance and how, at what point they were really collecting the data and what they were looking at and who they talked to collect this data and stuff like that as well. So there's, I'm sure, there is some, you know, if you only look at a certain, if you're only really focusing on the leadership engagement, then yeah, that might skew it a little bit. But I did notice most of the articles tried to look at pretty much every single CFR construct. A few of them would only look at like maybe the intersetting domain or something like that, but most of them looked at like they use the CFR framework, as a code book to look at every single construct, the impact that it had. So for the most part, there's obviously always going to be a little bit of, they might be over focusing on a certain area, but most they were very broad examination
Very
of
balanced.
these. Yeah.
Good, thanks.
And then just kind of again, kind of talking about the domains. Uh, they came from 3 of the 5 domains, but mainly from the intersetting and the process domains. So, intersetting's a very broad domain and it includes like different contexts of the organization where the program is being implemented. And then process is a little bit more abstract. It includes like active change processes and people that come from inside or outside the organization. There is no key determinants from the outer setting or characteristics of individuals. Outer setting is thought of as that kind of diverse context surrounding the organization. And characteristics of individuals, I just talked about a little bit, was people that were kind of involved with implementation and the relationship with it. As we were just kind of alluding to, these 2 domains do appear to be assessed a little less frequently in the literature, but there's not like lack of clarity in reporting often kind of hinders to know why. So, it's possible that people don't look at outer setting as often because it's maybe more difficult to modify some of those constructs. But, I think it's still important to assess them and consider them and be aware of them. And then, as I mentioned, this characteristics of individuals domain was greatly updated in 2022. And the updated framework, partially due to the importance of individuals, but also because people had provided feedback and said that they felt a lot of those constructs overlapped with constructs in other domains. So it is possible, that this domain, the characteristics of individuals, does kind of impact implementation more than this review found, but that it could be accounted for in other constructs. This gets very kind of nuanced and detailed and kind of difficult, but I think there's this noted issue with coding the determinant, especially with like the CFR framework. If anybody, I've done it on a project before, and if anybody else has, there's often, you have to be very detailed in your, code book, and often kind of questions about whether to double code or even maybe triple code different things, because there is such overlap between these determinants. It can be hard to really know what, where to organize it. You have to be very thoughtful in that. And then, as again, some of them didn't look at every single construct or only reported those that they found most relevant, but this distinction wasn't clear. However, again, as I just said, most of them did look at all of the constructs. But again, it's reasonable to assume that, constructs that you don't deem relevant wouldn't be examined, but of course, we can't really know that for sure. And then again, as I kind of alluded to already, it is important to mention that while ratings allow us to look at this impact of determinants and helps us to compare across sites, or in this case, across studies, they do gloss over the importance that is found in the qualitative data. So I think the sequential steps of collecting that qualitative data first and then creating the ratings is really important, instead of just going straight to the ratings or something like that, so that you can kind of, keep that nuance. And obviously a systematic approach or review, you're going to lose some of that nuance, but it's also important to help kind of move our understanding and advance the field. All right, so now I will kind of jump over to like a slightly different project that kind of uses some of the results from that, though, where I assess the association between key determinants and implementation outcomes by first developing a questionnaire and then administering that to researchers. So I first developed a questionnaire. I refined it through face validity. So in the questionnaire, I asked people to consider a recent implementation project and to retrospectively rate that project on 5 outcomes, and then rate the impact that 5 different determinants had on those outcomes. After I created this initial questionnaire, I met with 5 people for face validity sessions. They were all people that had a lot of experience with different implementation projects. We met one-on-one through Zoom for an hour. Didn't record it, but I took extensive notes and compared the notes across sessions. And the main focus on these sessions was looking at like what constructs I chose, their definition, the cognitive load of the questions, and the questionnaire overall. And this just reviews a couple of the changes that I made during those sessions. So I kind of changed some of the screening criteria. Originally, we were going to try to recruit both researchers and practitioners, but it became very clear that the language used is different. Sometimes they might use the same word, but it means a slightly different thing, which is kind of a bigger issue, which I'll discuss later on. But so it was clear it'd be difficult to create a questioning that would make sense for both people. So I decided just to focus on researchers at this time. Added a couple of different questions, changed the organization of it. And then in my initial questionnaire, I chose 5 of those key determinants from that systematic review, to largely just to keep the questionnaire at a manageable length. And then I chose 5 outcome factors, and I narrowed it down through, looking at the literature about what might make most sense to include, but also a lot through the discussion in these face validity sessions. And then finally, we just renamed 2 determinants very slightly, just for like clarity and simplification. So these are the 5 determinants and then the 5 outcomes that I included in the final questionnaire. I just talked about the definitions for the determinants, so I didn't include them here. Do include a very brief definition for the outcomes here. So, feasibility is that extent to a program, how practical it is, the extent it will likely be able to be carried out. Adoptions, that level of initial intake or intention to try the implementation. Fidelity looks at adherence or quality. Penetration looks at the spread, level of institutionalization, and sustainability looks at continuation or incorporation of that program long term. So this was the structure of the final questionnaire. The screening questions were fairly simple. They just needed to be a part of an implementation project in the last 3 years, had played a big enough role that they observed or knew about the processes and outcomes of the project so that they could report on it, and that the project was complete or nearly complete. We said at least 75%. And then here's just a little screenshot to try to give you a better idea of these main questions. So they first rated the project on an outcome and were provided a definition of that outcome, and it came straight from IOF with just a little bit of extra detail. And then they were asked to rate the impact of each of those 5 determinants on the outcome and provided a definition of that determinant. And for each determinant, they rated the impact as both a barrier and a facilitator separately. So they answered twice for each one. And we asked them to rate both as a barrier and a facilitator separately, because there's a lot of discussion about how these, impact or how these change over time. So something could start as a major barrier, turn into a major facilitator over time. And again, that might be just a natural change that might be due to an implementation strategy that's used, or something may be a major barrier throughout. But we wanted to try to capture a little bit of this, either changing influence or just kind of unique dynamic that these determinants have. And we didn't want to just have them think about what was their status at the end of the project, because that's not going to let us know what impact it had throughout. Or what, at the beginning. We wanted just kind of overall, so if it was started as a major barrier and then turned into a major facilitator, we would ask them to rate quite a bit for both of them, but just to try to capture a little bit of that dynamic influence of these constructs. So then I, once questionnaire was completed, reached out to implementation researchers. I mainly identified people through, or reached out to them through email. I would identify people mainly through journal searches, and then also looking at some large implementation research groups through different universities. I also reviewed the articles from the systematic review and an integrative review that I had done previously as part of my PhD program. And then when I emailed participants, I would ask them to provide contact information for any colleagues that they thought might be eligible or interested, to also try to do a little bit of snowball recruitment. I sent each person a unique questionnaire code, emailed them up to 3 times if they hadn't completed the questionnaire or replied, and each outreach was about 2 weeks apart. And then finally, I also used Circ to try to reach people. So they published information twice in their newsletters to members, and then also on Twitter, or X, it was still Twitter at the time. But that posting on Twitter was not very helpful, because we had to remove it after about a day and a half, just because of the massive influence of bots or fraud. We got about 600 participants in the first day, but I went through all 600 and there was only one that was real. So it was not a very effective strategy for us. But then each participant received a $25 gift card for participating as well. So in total, 282 people consented and began the survey, 49 failed screening, 25 didn't complete the questionnaire. So we had in total 208 participants. They were mainly white women living in the US that worked as a PI or a co-I on the project, and they had on average, or most of them had at least 7 years of experience in implementation related research. Just a little bit of, broad information about the projects and community of focus. About a little bit over half had a mental or behavioral health focus. Most were implemented in just one setting, but there's a very large range and number of sites. On average, there was about 4.5 different strategy categories for implementation strategies. Majority of the communities of focus, or majority of the projects, had 1 or 2 communities of focus, patient and provider or something like that. Majority served adults, and most were white, Black, African American, or Hispanic populations. And this kind of the information about the age, race, ethnicity, we just asked participants what largely represented the community. So it wasn't meant to be a fully accurate demographics table, but just to get a general idea. So for analysis, we ran multiple regression analyses, 1 for each outcome, and then these are all our adjusted R-square scores. It's be quite a mouthful, but I'll just go through all these results. So for feasibility, available resources barrier and leadership engagement barrier were significant predictors. For adoption, available resources barrier and facilitator, compatibility barrier, leadership engagement facilitator. For fidelity, available resources barrier, compatibility barrier, and external change agents facilitator. Then for penetration, available resources barrier, compatibility barrier, and facilitator. formal and total leaders, facilitator were significant predictors. And then finally, for sustainability, available resources, barrier, facilitator, compatibility, facilitator, both types for leadership engagement, and then formal internal leaders, facilitator. So again, that's a lot of information, but I kind of created this very simple table to try to highlight just where significant associations were found. So available resources was the determinant that was found to be most commonly associated with outcomes. It was a barrier for every single outcome and just a significant predictor as a facilitator for 2 outcomes. Thought that this may suggest that the lack of resources has a stronger impact on implementation than the plethora of resources. This makes sense if you think about, considering having like adequate resources are clearly important, but it doesn't really guarantee implementation success. But if you don't have those resources, you don't have the funding, the staffing, the time, that could prevent successful implementation regardless of other factors such as, compatibility or engagement or buy-in. Compatibility was the second most common determinant to be significantly associated with outcomes. So this was a significant predictor for every outcome except for feasibility. Thought it might not have been associated with feasibility because feasibility is often kind of assessed pre or very early in an implementation phase. In this case, projects included in this questionnaire were likely already deemed feasible and deemed compatible prior to starting the implementation effort. And that's kind of like looking back. If I were to, do this questionnaire again, I might not include feasibility in the questionnaire. Leadership engagement refers to, those leaders that may or may not be directly involved with the implementation, but are influential in the organization. So it makes sense that leadership engagement predicted sustainability, both as a facilitator and a barrier. Leaders have a very strong impact on funding, resources, priorities of the organization. So whether they're a proponent or an opponent of that intervention, they would strongly impact long-term success of it. And then it also, significantly predicted feasibility as a barrier and adoption as a facilitator. I think this just further, supports the vital role that they have regardless of their involvement. So whether like the lack of leadership engagement could prevent initiation or feasibility or support delivery or adoption of an intervention. And then finally, formal internal leaders and external change agents were not commonly found to be significant predictors, but they were significant functioning as a facilitator and predicted more of like the mid to late stage outcomes. Just kind of, hypothesizing a little bit, we thought, since external change agents typically come in more experience and expertise surrounding that intervention, their impact on fidelity makes sense. But they also sometimes, not all the time, but sometimes only interact with certain individuals in the organization. So their impact may not always be known by everybody that's being interviewed or filling out questionnaires about the project. And then formal internal leaders might be key in ensuring initial excitement and engagement doesn't wane too much, or that, they're particularly impactful later stage outcomes, for the penetration and sustainability. But overall,
did you find any collinearity between these? In other words, don't you see any relationship between available resources and leader engagement or formal internal leader assignment?
Like in the data, we didn't find any, but I do talk about that in a little bit too, though, about kind of the relationship between, no, you're fine. So overall available resources and compatibility predicted these outcomes more than others, suggesting that they just, consistently impact the process and in turn outcomes regardless of the type of project. And so they likely always warrant close attention in every implementation effort. But, it's, I also have to kind of be aware that, these determinants are fairly broad in scope, a little bit broader than some of the other determinants. So it's not too surprising that they came out as very common significant predictors. The updated CFR does put 3 different sub-constructs under available resources of funding, space, and materials and equipment. And then compatibility, it was in the updated CFR, the definition was simplified a little bit, but it still has a number of concepts. So, a program may be compatible in terms of its integrated into Epic charting really well, but it's not compatible with workflow and processes of, the people implementing the intervention. So I think for both of these, closer examination of like these two determinants in particular about like what resources are really making the big impact and what, aspects of compatibility is a facilitator or a barrier could kind of help us understand the impact that they have a little bit better. And then, I talked about these two kind of more exploratory aims to try to look at the field and setting specific similarities or differences. I'm just going to go over these kind of really quickly. Again, they're a little bit more kind of exploratory also, but so I'm not including the specifics, data for it, but I do have that if you're interested. But so here we're looking at comparing mental health and non-mental health programs. And I'm just going to review the similarities across program type. For feasibility, that ANOVA for non-mental health programs wasn't significant, so there's no similarities. For adoption, available resources barrier, compatibility barrier, leadership engagement facilitator, nothing for fidelity, and then for penetration and sustainability, just available resources as a barrier. Were significant, so looking across the outcomes, not including feasibility where that ANOVA wasn't significant. Looking across the other ones, there's 5 predictors that are similar across type and 11 that were different. Available resources as a barrier was significant for both program types and 3 of the 4 outcomes as well. So kind of aligning with the overall results. And then for the clinical and non-clinical settings, again, for feasibility, that ANOVA wasn't significant. For adoption, just available resources as a barrier, nothing for fidelity, penetration, just formal internal leaders as a facilitator, and sustainability, available resources as a barrier.
So clinicians from mental health were not interested in fidelity at all.
Yeah, clearly, but I'll talk about this a little bit. This I didn't really have quite enough power. The sample sizes were so small once I stratified them, so that's kind of why this is a little bit more exploratory. But yeah, apparently fidelity didn't matter. But then, so I already discussed a little bit about like my kind of interpretation or kind of hypotheses related to the results, but looking a little bit more broadly, when comparing the individual and organizational level determinants, the 2 organizational level determinants, available resources and compatibility, predicted outcomes much more frequently than the individual level ones. But, as I'll discuss, and we kind of mentioned already, the individual and organizational determinants certainly impact each other. And, some of like, again, as I said, these organizational level determinants are fairly broad in scope. And so it's easier to recognize that impact sometimes than the individual level determinants, I think. So, I think closer examination of those is warranted. And then real just briefly, a little bit more about that field income setting comparisons. There were a number of similarities, slightly more for the comparing the program type than the clinical or the setting. But again, this is really just exploratory. The sample sizes were a little bit small, but I presented them just as simply like a suggestion or an idea that this is something I think that would be worth looking at in future research of certainly it's always relevant to look at just certain fields or settings, but to combine it, I think in implementation science, that there's likely things that are persistent across sites and field that are going to impact implementation. It doesn't matter if it's, for diabetes care or cancer care, there's always going to be different things that impact it. But I would hypothesize that maybe the setting, there is more differences just because sometimes settings, like you have different internal or external, like your funding policies or different mandates that might impact implementation, like a federally qualified healthcare center that receives funding through government or a different public sector might have unique restrictions on how funds can be distributed that other organizations may not have, things like that. So it's something I haven't seen too much that I think would be, worth looking in a little bit more in the future. And then just a couple little quick limitations of this, that journal author search, often research coordinators or PhD students would be included, but their contact information often wasn't easy to find. I did try to get some of them through the snowball sampling recruitment, but these were very undersampled. So, in our sample, 77% were PIs or co-Is, only 4% were coordinators or assistants. And so I think it just, we're getting a certain perspective, and sometimes the coordinators are really a little bit involved with the project in a different way than PIs or co-Is, so they might have a different perspective on projects as well. So getting their perspective, I think, is really important. And then, as I mentioned, a little bit earlier, we're not able to make any statement about like the impact of strategies. So again, this questionnaire is just a very early step in examining very broad relationship between these determinants and outcomes at a very high level. A future version of this questionnaire could be designed to better account for the role of these by asking more specific information about like what strategies were used, when, to what extent, and what impact people think that they had. Kind of about future research, the questionnaire that we used here, I think is very versatile because I think it could be used to assess impact of determinants with outcomes at like a very micro or macro level, and it could be used during or post implementation. So people with a single project could use this to assess the impact of factors on outcomes throughout the implementation in order to help guide the selection of implementation strategies or see where they need to kind of intervene and make mid-course adaptations. It could also be used following implementation to, understand results, or it could be kind of used similar to how it is here. It could be used like by an organization to examine numerous projects that they have and to try to better understand the implementation process at their organization. Next steps, I do want to adapt this questionnaire to fit practitioners. As I mentioned, initially I hope to recruit both. But this kind of disconnect between researchers and practitioners is like a bigger issue in implementation science. And it's like in opposition of that goal of reaching or breaching the research to practice gap. And there have been, a number of kind of critical assessments and about this in the literature and a lot of recent efforts to make it a little bit more relevant to practitioners, but if, we don't continue to focus and work on that, then it'll just continue to persist the research to practice gap because the real, kind of utility in the real world will remain limited. And then finally, from that systematic review of AIM-1, 5 of those 8 key determinants, 5 were individual or people focused, but in that questionnaire, the organizational determinants were found to be more consistent predictors across all 5 outcomes. So I felt that this was a little bit of a juxtaposition between the 2 findings. Individual level or individual or people focused determinants and organizational determinants certainly impact each other. Like a leader has sway in how resources are distributed, but at the same time, an organization's structure and competing interests impact what resources that leader has at their disposal and the time or energy staff have to work on something. So I think future research really needs to start to kind of disentangle the impact that these determinants have on each other and how they impact outcomes and things like that. And there's been a recent argument towards doing that. I've seen a couple of studies that have started to look at more relational approaches to like theory and analysis, but I haven't seen a whole lot out there yet, but I know there's continuing to be a shift in that way. I think it'd be really important to see how particularly I'm interested in how the individual and the organizational level determinants interact with each other. And then finally, I mentioned that I wanted to kind of connect this to some recent reflection in the field about the progress of implementation science. So this article, it's 2022, so it is a couple years old already, but it was written by a number of very prominent researchers in the field, and they identified 6 threats to the field and then opportunities to address those threats to help improve impact. So these were the 6 threats that they identified, basically not impacting population health or health equity, being anchored too much on trying to be a legitimate science, recreating that research to practice gap, not balancing it and making it accessible to people while maintaining the coherence, not having priorities that align with partners, or not having strategies that are matched to partners' needs and things like that. I'm not going to go over all those solutions. There's a number for each one, but I just wanted to highlight two that I think that the work here kind of really started to address. So, first by identifying those key determinants, well, again, not ignoring the impact that every determinant potentially has. I think we can move these frameworks towards being a little bit more useful aside from simply listing important factors to consider. So, again, as I talked about, there has been some work looking more at like the relationship between determinants as well, which I think is really important to help guide to more like causal frameworks and things like that. And then the second solution here at the bottom, to me, really touches on the lack of systematic understanding. So much of the research still is so hyper-focused about the context, and there's always going to be context specific, differences or issues with projects. But if we don't, continue to try to look at a more systematic view and get an overarching understanding of the implementation process, it's just going to kind of continue to be these, individual case studies, but without like a deeper understanding of things that can help progress the field. And I think review is just, again, a very small kind of early step towards that. But then also this questionnaire as it looks at diverse projects across the globe and, combines that information. But again, I also think a shorter kind of version of this questionnaire could be used during projects to help see, what's having the biggest impact and kind of make those mid-course adaptations as well. And then, so, a lot of these threats in the field, as I kind of talked about, I think a lot of them have to do with not having true community engagement with the work. So not really, as long as in terms of like not impacting health equity or recreating the research to practice gap, that these programs are, still not fitting everybody that they should, be addressing, that it works for people that are already getting services or already, that are already in the clinics, but it's not reaching new people or things like that. And then having, again, not being as practical for practitioners as we want. So I think a lot of this talks about like just not having enough like true community engagement, which is really, a strength of MCW. And, while it's certainly very difficult for projects and researchers to often have true community engagement, especially for people kind of trained in more medical models of research, I think that, it's really important for this type of work to improve access and improve programs and outcomes. So it's, it's a necessary aspect of the work, even though it can be very difficult. In particular, addressing equity is really crucial, and it should be explicit because, again, if not, we're likely going to reinforce or exacerbate issues surrounding equity, particularly, our access, and making sure that these programs work for everyone. And I think, when I look in the field, it seems like a lot of times people they say that they don't know like how to approach equity in their projects, but I think there's been a number of suggestions on how to make like small but potentially impactful changes, and to kind of make sure that we're prioritizing that in the work that we do. And just I'm pretty much at the end, but I just want to do a really quick example of one thing that I found is this Aspire framework, or adapting strategies to promote implementation and reach and equity. And it was initially developed for school mental health services, but it's, I think, really applicable to any type of project. So it just, suggests when you're planning an implementation strategy to first identify those underlying assumptions of that strategy, then think about potential sources of disparities surrounding that strategy, and then adapt the strategy to ensure equity and make sure that you're considering ways to produce or reduce those disparities. And, while I've only been at MCW for a few months, I was very aware of MCW's strong community engagement prior to being here. That was one thing that kind of attracted me to this organization, but also I just kind of know about kind of, the number of people that are doing or interested in this type of work. And so I guess it was kind of like, a call or recognition that I think, MCW really does have the resources and the expertise to make a strong impact in kind of implementation science. And be able to kind of help, advance the field and advance kind of the impact that we have in our local community as well. But so in conclusion, just going back to the work that or research that I was talking about, I think that the findings here kind of just expand on knowledge on implementation and contributes to this emerging body of research on the relationship between determinants and outcomes, as well as recent efforts to look at implementation a little bit more systematically. And I think identifying key determinants, again, will help us move to understanding a little bit more about complex relationships and go towards more causal frameworks. And I think particularly looking at determinants with the impact as a facilitator or the barrier separately, I think we're able to better understand how they impact the process and make sure that we're not underestimating or overestimating their impact. And then again, that just kind of helps to guide the process to make more adaptive approaches and in turn, improves implementation and sustainment and to help improve outcomes in the community. Right, well, that's all I have. I'll stop sharing.
Fantastic talk. Thank you so much, Mary. So I have a couple of comments and questions. Isn't it amazing that an implementation science as a field, the more it progressed and created more research and more science, we recreated the same gap between research and practice. And it's kind of a mental knee-jerk reaction of mine a lot of times in different groups where people talk about research, and I keep reminding them that they are practitioners in the field also who need to be incorporated in the discussion and approaches. So in a way, it takes you back to Ev Rogers' days here, and he talks very clearly about schools of thought and traditions that over-dominated, over-anchored certain theories, and everybody outside those specific schools of thought were not as legitimate, and the field suffered because of that. And I think you're addressing that extremely important part is where do you start? How do you assess determinants? Because we often go determinants, mechanisms, strategies, outcomes. We are successful in a research project, and then we say, well, we really like those outcomes. Let's apply the same strategies in a different setting or in a different organization, and everything falls through. And we're like, oh, we didn't consider the social determinants of health, so then this minority would benefit. And then it becomes all about targeting a specific subgroup, and again, ignoring the fundamentals that your determinants inform, in fact, the mechanisms, and then your strategies are based on those that will lead to the correct outcomes. So, and again, it goes in my mind towards the concept that in order to design sustainable, adaptable, and universally successful type of frameworks of approach in different settings and different time frames also, you need to have that kind of good battery of determinants related to the specific mechanisms, related to the specific strategies, and then you reassess that matrix in the new setting and see how do we approach this. A second comment about that is about, and I think it's lacking in a way because we're looking again at what exists in literature existence about research, but in practice, think about if you're addressing an issue of implementation science, let's say in a psychiatry and mental health clinic, and you're trying to address stakeholders that are different, such as, let's say, a nurse navigator versus a clinician seeing the patient. And determinants of specific outcome for those subgroups, those different stakeholders may be very different. You may get a +2 for leadership from one and a -2 from the other one. So almost takes you to the methodological issue of, do you just use the absolute value and add them up? Because if it's a -2 for one and a +2 for one, that means leadership is extremely important. Just add them up in absolute value and consider that that's a significant signal instead of canceling each other, right? So let me stop right there because I know it's a long comment, but you may have some thoughts about it.
Yeah, well, definitely about the last thing that you said about the like canceling each other out. I didn't mention, but there were a couple articles that did averages of the rating, and I didn't include those because the averages would often end up being, like zero or like
Yes,
one.
yeah.
But, when you look at the data, it's, yeah, some people think that it was a major barrier and some people think it's a major facilitator. So you have to be conscious of, yeah, how you're looking at that. But yeah, I think it's, with any, while this field is certainly not new anymore, it's still newer compared to others. And I think when you're focusing so much on securing funding and, being a legitimate science, and community engagement, as a lot of us know, is really to do it correctly and to do it well is very difficult and time consuming. And so I think, people, it's very easy to say, oh, maybe next time I'll do this or something like that. Like you want to do this initial project, but then again, I've been a part of a couple implementation studies and it's, it kind of is, we've had some similar issues where once the study is done and it's like, well, once this external help is gone, they're a little bit better equipped to sustain it, but it's still really difficult. And so it's, maybe we're not taking as much of a step towards true sustainability or sustainment as we want. Not to say that, absolutely, I think that this work is really important and very vital. Not to say that I'm, not agreeing with that, but I think just making sure that we're being very conscious of, the, you know, the real purpose of this work and not just, doing more research and thinking about that and just kind of being very conscious, thinking about the long term impact and what, yeah, the real goal of this is. But yeah, it's difficult.
It is. I just came from a specialty specific sleep medicine conference, international conference, and one of the very few people in my field who does, in fact, implementation science presented yesterday, and I listened to that presentation. And one of the good questions at the end came, okay, so you were extremely successful, you published, this was an amazing project, it went on for 7 years. So what's next? And the answer was, well, nothing. The funding is ended. It's done. We cannot scale it up. We cannot sustain it. That's very sad, right?
Yeah. I think also trying to think about, people talk about trying to think about sustainability from the beginning. And so I think, talking, if you're coming in as like an external facilitator to help implement something and you're not going to be there forever, talking with them from the beginning about like what changes they might need to do internally to help sustain this so that when you do leave and when some funding that you have or resources that you have leave that they are able to sustain it because that's the end goal. This isn't another research study. I mean, it is, in a sense, but the goal of it's different. So thinking from the beginning, how can this be sustained, so that then we could come back 2 years later and collect the data to see, look at the reach and penetration of it over the last couple of years, so we can look at that long term. But then also taking that information and developing, like toolkits and guides so that and making that available online so people then can more easily implement it, in their own organization or their own settings. So that it's more than just like a research paper that can, have a lot of practical information, but sometimes when you read, a paper about a study, it's like, oh, that sounds great, but how would I really implement that in my organization or something, So providing more practical, dissemination information as well, I think is really important.
Absolutely. And this is the exact setting that is perfectly situated because that's the role of CTSI, right? We have a very strong community engagement and we need to take it to the next level by using these type of frameworks and expertise embedded into these groups and continue to be successful and scale it up and sustain it. But also we have the translational science teams, we call them ensembles, and they come together from different realms of research or different scientific areas, and they say, well, this is an identified problem, we need to fix it. And they would definitely benefit from the capacity that we're building in the field of implementation science to get advice, guidance, identify upfront what are the barriers, what are the facilitators, and what types of strategies do they apply so then they can become successful.
Yeah, definitely. That's what I also think, yeah, as a medical school, you're in a unique position of engagement with community organizations, but then also in clinics and with medical students to help, provide that education. So as they move on to wherever they go, that they're able to help improve services as well.
Something else you mentioned, it's a little bit harder for individual level or smaller group level to identify what other individual or group level factors exist in the organization that are important determinants, either barriers or facilitators. A lot of times people don't have knowledge of other groups or dynamics or operational fields, and they resort to looking at leadership and say, oh, that leadership is a problem, or we didn't have an external facilitator to help us. But they really need to be brought together to say, hey, by the way, they are additional facilitating factors already in the organization at the individual level.
Yeah, yeah. Definitely.
Any questions online or anybody else?
Nothing in the chat.
Yeah, can I?
Well, this is fantastic. I'm sorry, there is a call. Okay,
Yeah.
Lisa.
Sorry.
Hello.
Hi. Thank you for turn my camera on. Thank you for the interesting talk. So I guess first, just kind of a clarification question. You said that most of the papers you read, you reviewed frame one, they looked at every single construct in the CFR, which is kind of surprising to me because that's like kind of not the way it's intended to be used. But then later you also said that, you think part of the reason that none of the outer setting constructs turned out to be like key determinants was because people didn't think those were relevant. So I'm not sure.
Okay, yeah. So, well, most of them did look at almost all the constructs, but I'd say if they did
Almost.
not include all of them, the outer setting was the most frequently one that they didn't include, that they didn't look at. But then, there were some that, like some would use a code book of every single construct. And then, yeah, some would just look at, these were what were, we as an internal team or as them as a certain, some team identified as what they think was most relevant. But that wasn't always clear of how they came up with that. So yeah, it's not always included. I'd have to go look back at the big data table that I have, but I was surprised too that most of them did look at pretty much all the constructs. And I think maybe it's just because they were using that rating scale, so it was easier to like code it for all of these and then try to rate them. Where if you weren't using the rating scale, it probably would be a little bit more difficult to do that, and they might just focus on certain ones. That might be why, because I know definitely when you're looking at the literature, they're often not looking at every single one. But yeah, so I think it might just be because they're using the rating scale.
Interesting. So do you think that your findings had any implications, or just informally, did you kind of draw any inferences about like how the CFR should be used? Like whether there should be an additional step where, or maybe researchers just need to be more explicit about why they select certain constructs?
Yeah, I think a lot more, just even just a sentence or two about why you are looking at what constructs you did, or because again, sometimes if they didn't include them, it's, was there some evaluation that you found that these weren't relevant and that's why they're not included? Or was it because your study just decided that you're going to focus just on these for whatever reason? So I think being just more clear in, when you're publishing a manuscript about what strategies you looked at or determinants you looked at and why. But yeah, for kind of making it Justin, I think I would love if the CFR could become, something where you are able to kind of like almost like a hierarchy of like, these are, like most commonly going to be making the biggest impact. So you always have to make sure that you're looking at these, and then, kind of like go down of, these are other ones that you consider. But, again, as there is so much context specific, ness and implementation science, there's always little caveats to everything. But I think, having more frameworks that can be a little bit more useful and helping people figure out what to look at. I think, that would be that was kind of, a long-term kind of goal of this initial project would be to try to help kind of lead towards that direction.
Yeah, kind of narrow it down.
Yeah.
People.
And again, not ignoring all the other ones, because I don't want to make it sound like I'm trying to just, make it into a list of 8, constructs or something, but trying to help, when you have limited resources, what should you focus on if you can't, focus on all of these, or you can't make a decision in your team, you are disagreeing about what to focus on. This might help make, guide that decision a little bit.
I'm also curious, sorry, if someone else has a question, please jump in.
No, go ahead, Lisa.
Too many questions. So I'm also curious whether when you were looking at the data, you noticed that different types of practitioners or people, maybe researchers with different types of projects, thought that certain constructs were more important. Because like maybe, for example, people from public health would be predisposed to think, oh, like outer sending constructs are really important because it's like the environment and so.
I didn't notice anything. I have to go back and look. I don't think nothing popped out. I wasn't really thinking about that either. That's a good point though.
Yeah, thanks.
Yeah, thank you.
Lisa, you're bringing up a great methodological issues, right? Because even for peer review, we look at, well, they use CFAR for determinants, so valid, they did a standard grading, it's valid. But maybe methodologically, we have to be a little bit more thorough to say, well, out of all these contextual factors, the team decided that these are not important and we voted, or we thought these do not apply, and it should be explicit. You're absolutely right. Because then there is a skew there from what you analyze and what you exclude. And you almost wonder that if you had frameworks that will work very well in a staggered multi-level fashion, you expand because you think that category does apply to you, and then you kind of go deeper and deeper and kind of have to go through each one of them to see, does it apply or not, is it important or not, right? And which CIFAR does have. I mean, you do have a little bit of aggregation and clustering there, but to what extent there are other approaches that are better or easier to use, I don't know. Other questions, comments?
Nothing was typed in the chat, but the floor is open.
Well, Lisa, thank you so much for attending, and we'll continue to send you invites. We're
Nice
very
to see
happy you are part of this group. And Marin, thank you so much. This was wonderful. Let's keep the collaboration open, and we're looking forward to have you as part of the CTSI Implementation Science Group. This concludes our last presentation of this academic year. We will restart in the fall with implementation science. Thank you so much and have a nice summer.
Thank you.
Thank you all.